One of the biggest challenges infertile couples face is deciding which IVF clinic to go to. If you want to find out the answer, watch till the end of this video. I'm Dr. Malpani, I'm an IVF specialist. And you might say, if you're an IVF specialist, your advice is obviously going to be, hey, I'm the best IVF doctor, come to me. I will provide you with the best quality medical care. Isn't that what every IVF specialist says? And isn't that what every IVF clinic wants? As many patients as possible. So why should I trust anything you have to say? I think that's a great point. And my point is you should not trust anything anyone says. You shouldn't trust anything any website says. You shouldn't trust anything I say either. Because you're quite correct. That trust needs to be earned. You can't afford to give it away for free. And the only way to allow a doctor to earn your trust is by doing your own homework for yourself. So you understand enough about IVF so you can ask the right questions. Otherwise, this can be dangerous because it's very easy to end up in the wrong hands. Part of the problem, of course, is that every website looks like every other website. And quite frankly, lots of websites will copy and paste information from others. I've seen that. I mean, we've had a website now for 30 years. And now every IVF clinic comes ahead and feels free to copy and paste. And I say, well, imitation is the best form of flattery, and as long as they're disseminating reliable information to patients, that's fine. So no objections with that. But the problem is that the information they provide isn't reliable because these guys are out to sell. They make all kinds of false claims. They claim pregnancy rates of 70%, 80%, all kinds of rubbish, completely false, but there's no one to challenge them. So what can any patient do? And obviously every patient gets attracted. Wow, 80% success rate. Obviously this guy's got to be much better than Dr. Malpani. Why the hell am I going to Dr. Malpani? I should go to someone who gives me a success rate of 80%. Lots of them have great marketing tools. So they will call you back. They will keep on, I shouldn't use the word pestering, but convince you why you should come. They'll offer you free consultations because they know how once you come to the clinic, to bakra pakad gaya, then it's fairly easy to upsell and cross-sell and all kinds of things. So they use a lot of dodgy, shady techniques because their primary purpose is to get as many patients as possible to maximize their revenue. So then your next question is, but isn't that true of you, Dr. Malpani, as well? Don't you want to treat as many patients as possible? What makes you behave so holier than thou? You're going to do exactly the same thing all these other guys do. That's the beauty. I don't need to. One advantage of having been an IVF specialist for 30 years is I'm well off, wealthy. I don't need to practice medicine or do IVF anymore in order to earn money. So I do IVF because I enjoy it, because I'm good at it, because it gives me great pleasure to help people to have a baby, to complete their family. That emotional income is enormous and I do an extremely good job. So I think that's fine. I think the question is that, am I doing it for the right reasons? And now I'm doing it because I want to do it to help patients to have a baby, not because I need to make money. So to that extent, it helps being born with a silver spoon and not to have to worry about money. So I can give patients advice which is in their best interest. I can say, look, you don't need IVF. This is a simple problem. You can solve it for yourself. Or there's no need to come all the way to Bombay. Fix it yourself locally. You can do simpler treatment like IUIs or ovulation induction. I can afford to tell the truth to IVF patients because I don't need to earn money from them anymore. Great spot to be in. So I'm wealthy. The money is optional for me. So I don't need to grab every patient who comes to me. I can give them honest advice. And much more importantly, I have tons of experience and tons of expertise. So I can tell them what's right for them. I think that's what my magic sauce is. Still skeptical? So why don't you do one thing? Go look at anyone else's website and then come to ours. Ours is www.drmalpani.com. And the first thing you will see is we have so much more content on our website. We've got over 1,000 pages of information written for the IVF patient, simplified, no jargon, made crystal clear. And this is all information which I have taken pride in authoring myself because I understand as an IVF doctor what IVF patients want. And I'm happy to share information. I think the more you share information, the better it is for everyone concerned so that patients can learn for themselves and make the right decision. So my whole point is, don't trust anything I say. Find out for yourself. That's great for you and that's great for me. And actually, that's great for every IVF doctor, because every IVF doctor wants their patient to become an expert. So they have realistic expectations. They understand what the doctor is doing, why the doctor is doing it, what's in the doctor's hands, what's not in the doctor's hands. So then the focus is on the process, which is what doctors can control. It's no longer in the outcome, because that's not in anyone's control. So look forward to seeing you digitally online on our website. And I'm happy to offer a free second opinion. Again, no strings attached. The reason I offer a free second opinion is I believe in karma. I'm not going to tell you, hey, come to me. If you want to, please do. I'm happy to treat patients. I do a good job at that, and it gives me pleasure. But even if you choose not to come to me, I'm still happy to provide you with the right advice to help you to have a baby. Look forward to seeing you.